Welcome to Beyond Bones and Muscles, a Legent Health podcast. Created by the team at Legent Health, a healthcare system devoted to helping you live life to the fullest. Your health, our priority. Each episode, Chief Operating Officer Daniel Rizal keeps your finger on the Legent pulse, going beyond the bones and muscles of Legent Health. We will discuss orthopedic and spine industry education and analysis, along with news from around the Legent healthcare system.
Hello, everyone. My name is Daniel Rizal. I'd like to welcome you guys back to our Beyond Bones and Muscles podcast. I'm excited that we have this session going on. As you know, I'm the Chief Operating Officer for the organization, and for this podcast, we're going to be talking about something that we live and breathe every single day. As you know, as an organization, we run 4 hospitals that we own and operate, and we also have 9 surgery centers as well, ambulatory surgery centers within our infrastructure, and we've got many more in the pipeline as well. But for today's conversation, we're going to be really digging into kind of the nuts and bolts of ASC operations and, you know, what are the key business drivers and operational drivers for running a successful surgery center. Many of us have been in the ambulatory space for many years. For myself specifically, I've worked in surgery centers for about 10 years now, so I've sort of seen the large-scale multi-specialty centers, the single-specialty centers, you know, very small, very high volume, highly technological, and then some that are kind of mom-and-pop surgery centers. And each of these surgery centers takes on a life of its own. But what we want to talk about today is, you know, what are some of the key drivers to really lead to a successful surgery center? So I'm excited. We've got 4 guests with us from the organization, 4 leaders. We've got Brittany Schmitz, who is our RVP for the DFW market. Many of you already know Brittany. We've got Virginia Snyder, who's our administrator and DON for our Delray Beach facility. We've got Mark Michelson, who leads our procurement as our VP of procurement, and then Lori George is our regional quality leader in the San Antonio market. So excited to have all 4 of them on. So let's get the conversation started. Now, and Brittany, thank you for being in studio. I know the rest of the team is remote, but good to have you with me today. One of the key elements of leading a successful surgery center and a successful partnership is physician engagement, right? Physician engagement, as I like to tell people, is an art, not a science, right? Because each physician's got their own nuance, different personalities, what makes them tick, et cetera. So starting the conversation today, I'm going to just ask this question. Why is physician engagement so important? And clearly you're one of the leaders in the organization and have been really successful at it, but what all goes into it?
Well, a lot goes into it. But when your physicians are engaged, your surgery center is going to be successful. You have better patient outcomes. Your quality outcomes are better. Mm-hmm. You have cost reduction, and you have overall alignment. So, I mean, we want our surgeons to be engaged. It's the bread and butter of an ASC and how it operates.
It sort of goes without saying, but it still has to be something that is systematized within an organization, which I think we've done a really good job of, and you've really taken the lead with that. So what are some of the elements, some of the key elements when it comes to physician engagement that you monitor and, you know, and potentially even mentor your team to ensure that you have that level of engagement?
For me, it's all about getting data to the physicians.
Right.
Whenever a physician feels that you know what you're talking about, they'll listen. You know, so if you come prepared and you know what their costs are, what goes into their procedures, what their, you know, how they operate, how they want to take care of their patients, mm-hmm. They listen. Yeah. So it's, you know, your physicians, they see their patients every day. They do assessments. To diagnose their patients. They take that very seriously. So they don't just make decisions on a whim. Yeah. So I've had really good luck by sitting down and saying, you know, hey, Dr. So-and-so, here's all of your information. Here's how much this procedure costs based on, you know, our other providers in our system.
I want to expound on that point because I think that is key, because that can sometimes backfire on us, as you know, because you're, you know, calling out one's physician over another, but it also can create some positive peer pressure. Can you kind of talk through that process?
Yeah, well, I mean, 87% of cost in healthcare is related to physicians and their preferences. So if physicians are going to be partners in an ASC, they want their patients to have quality care. And the whole point of the ASC is to help reduce the cost of healthcare.
That's right.
So whenever you have good physicians, which I think we do within our organizations, our physicians are phenomenal. They listen, right? So I don't think it's necessarily, you're not going to sit down and call someone out. You sit down and you say, here's how much these things cost, right? Here's how much this one dressing cost, and this is how much it is annualized. On one dressing that you're spending in the surgery center, you're spending $100,000 compared to these other surgeons who don't use this product, and it's maybe $20,000 over a year.
That's right.
And so I think you don't ever approach it as you're doing something wrong, right? Because the reason physicians pick something that they want to use for their patients because they believe it's superior. It's quality. Right. It's going to make their patients better. So I think having that conversation with, are you willing to trial this other product that has the same, quality, but the cost is lower? They 9 times out of 10 are open to it.
Yeah, agree. I think when you talk like for like when it comes to products, for the most part, there's some adoption, but obviously we know that some habits are hard to break. Right. When it comes to the 10% of the time where you're not able to be successful, how do you escalate that? Because I know one thing that you've mentioned to me before was trying to align yourself with what we call physician champions. Can you expound on what that even means? Absolutely.
So I always have a physician champion or multiple, depending on the size of the facility. Yeah. But having a peer that is able to talk to a physician to physician, they speak the same language, right? They don't speak operator. So they're like, that they're able to break boundaries with them, explain clinically. They have respect for them because they're in the same, line. They know exactly what they're doing. So having a physician that understands that is paramount too.
Yeah, very excellent. And the last thing I'm going to ask you before we move on to the clinical component of running a successful ASC is you've got leaders under you, that work under you in the organization, and you have really bottled up physician engagement to a science, right? And I know I said it was an art before, but you've turned it into a science with your success. How do you get other leaders to kind of follow your lead or teach them some of those principles as well? Because again, to be successful, physician engagement is paramount. So how do you go about educating and mentoring your leaders?
So I worked with Mark, actually, and my team, and we created a standardized onboarding for physicians. Nice. And it's a checklist, right? But I also partner with all of them. And so as soon as we go through an onboarding, I'll do one with them. And they see, we're going to talk to the physician. We're going to ask them about all of their preferences, including what do you like to eat? What do you like to drink? What snacks do you want to have here? Let's make sure we have your badge. Let's ensure that you have everything that you need, because at the end of the day, your surgeon is a surgeon because they're particular. Mm-hmm. And you want your surgeon to be particular, right? So I think as operators, we have to understand that our physicians, they want everything to be perfect. They have patients' hands and, patients' lives in their hands. Right, exactly. So I think understanding that and then ensuring that we do everything possible to decrease their anxiety and they know that we're prepared. I think that's all, that you have to do. So that's what I do with my leaders.
Excellent. And I know one thing, and I'll wrap up with you, is you made the point to me many times is you have to be present with your physicians, right? First case, when they just get onboarded, be there with them, follow up with them. So I think that's a good note for all of us as leaders is with our physicians, they want to know that we're there to support them and to be present. And that kind of takes on its own connotation, but presence meaning you're available, you meet their needs, and sort of the list goes on. So thank you, Brittany, for that. And as we go through this conversation, we may, pivot to you for some additional pieces of context as well. So thank you. All right. So as we talked about at the onset, we're talking about successful surgery centers and how do you operate a successful surgery center. you cannot operate a successful surgery center without having positive, consistent clinical outcomes, right? That's sort of something that we take for granted at times by just making that broad statement. But clinical outcomes are key for us to have successful surgery centers within our organization, which kind of goes without saying. So, Lori, again, thank you for joining us as well. As I mentioned at the onset, Lori is one of our regional quality leaders and really takes the lead in one of our larger markets for San Antonio. But I'm going to ask you this question, Lori. When it comes to clinical outcomes, what does that mean to you, and what does that mean in general when I make that statement, good clinical outcomes?
So, as you mentioned, we have numerous ASCs within our organization, and we should always strive to have safe or provide safe, effective, best practice, and timely care. When this is our collective goals, patient outcomes they're just going to be better. We can achieve this by ensuring that we meet or exceed all of our required quality elements. These are set by our regulatory bodies, such as Joint Commission, AAAHC, but also by meeting those goals of our internally set projects.
No, that's great. So as we think about the quality measures and how we monitor them, can you talk a bit more about that? Because you mentioned there are some set guidelines that we need to follow, set by, state and federal organizations, but then also internal benchmarking as well. Can you elaborate on a little bit more about what those elements are that we monitor?
Great question. And I know a lot of people think when we talk about quality measures and things that we monitor, what does that entail? We have a third-party vendor called Press Ganey that helps us with patient engagement. Remember, our goal is to provide excellent care and to have satisfied customers. It's an important to remember that our ASCs are graded against other ASCs all over the country. And we're graded in many categories, but some of those categories include overall patient satisfaction, how well are we communicating with our patients, would they recommend one of our facilities to their family or friends, how well are we communicating our discharge information. And so this is a very competitive market. As you know, we have more ASCs coming on board. We have several already up and running right now. And so we know that this is competitive, and it's very hard to stay in that 90th percentile that Press Ganey puts out. And, I'm excited to share with you guys that some of our facilities are meeting that 90th percentile. That's difficult to achieve, yes, it's great. And as you mentioned before, there's a lot of our facilities that are going up. There's 2 coming up in the Hill Country. And again, meeting that 90th percentile is just a testament of the dedicated staff that we have in those facilities.
No, 100%. And, it's interesting when we look at the data between our hospitals and our surgery centers, how much more competitive our surgery centers are when it comes to reaching the 90th percentile and maintaining that level of high scoring. It's not a walk in the park compared to, I'm not saying the hospitals are either, but I think definitely when you talk about the ASCs, the competition between the performance is a lot closer. So with that being said, then how do we work on improving our patient engagement within our surgery
Sure,
centers?
that's a great question. So, as I mentioned before, we have a third-party vendor called Press Ganey, and this vendor sends out all of our patients' surveys. And a way that we can help meet those goals of patient engagement is to look at those comments that our patients are providing. Answer any questions that they may have. Leadership should be performing rounding and talking to these patients and making sure that, we're identifying areas of opportunity. Press Ganey also has a solution starter that can help us, focus on lower scoring questions. We should always use patient feedback as a starting point for any performance improvement.
No, you're absolutely right. One of the things we're trying to incorporate into our monthly operating review meetings is getting that feedback and closing the loop on the Press Ganey feedback that we're getting on the scores. because some of the things that we look at is we can categorize issues relative to where we need to improve, and it might be on discharge instructions, it might be on communication, might be on anesthesia. There's the word slips my mind, but how they communicate with the patients as well as far as the instructions. So all that feedback is really critical for us, but it's not the only measurement in regards to outcomes that we really hone in on. What are some of the other potentially more acute matters that we want to look into when it comes to our quality outcomes?
Sure. Great question. So we need to ensure that we're following best practice, and we need to prevent those never events, right? The best way that we can do this is to provide excellent care to our patients. That's going to, like I said before, help to improve our patient outcomes. An example of those measures would be fall prevention. Rounding on our patients to make sure that we're in the place that we need to be to prevent those falls. Avoiding medication errors by using the 6 rights when administering those medications, following our infection control policies and procedures, like proper and frequent hand washing, making sure that we're maintaining sterile technique, that we are doing our patients justice by using the appropriate surgical prepping, and again, providing that excellent care.
These never events clearly are that. They're events we never want to occur in our surgery centers, but there are situations where they do occur. We know that. We've been in healthcare long enough to know that these are inevitable. But the key for us and for the audience to hear, for our teammates to hear, is when we do have a never event, what we want to do as an organization is to understand and learn and to put steps in place to prevent that from happening again, right? So what we like to do is root cause analysis that are performed by the clinical and the operational team. Understand, did we follow the process and there was still something that came up that caused a never event? But if we didn't follow the process, right, then that's a different conversation we need to have with our leaders to ensure that they're following the guidelines and the policies that we put in place so that these never events never happen, right? So in closing, Lori, anything else you'd like to add to this point, which is critical?
Again, I just want to shout out to our ASCs. They're doing an amazing job. They're looking at ways to prevent these never events, and then they're following through with them.
Really good information. Thank you, Lori, for that. And team, if you guys have any other questions, obviously you've got your regional quality leaders. You've got Lisa Tarkington as well, and they all partner really well together. But they need to be your support at your facilities for the clinical components of it. So don't hesitate to reach out. Lori works, I think, 24 hours a day. I think that's what you told me. So she's always available if needed. So, but anyway,
absolutely.
Thank you, Lori,
thank you for having me.
Absolutely. All righty. So again, kind of going back to the purpose of our podcast is how to run a successful surgery center. So we covered physician relations, which is key for keeping the physicians in the seats and keeping the volume pumping through our facilities. Clinical outcomes, which is a foundational component that has to always be front and center. But there's 2 other pieces as well that really drive the bottom line and the efficacy of our ASCs, and that's labor management. How well do we do that? And then we're going to get to our last segment in a few minutes with Mark on procurement, medical supplies, and ensuring that we have the right process in place to maximize our reimbursement, maximize our margin, when it comes to our procedures that are coming in the door. But before we get to Mark, Virginia, thank you for joining us as well. And you run a very efficient surgery center in Delray Beach. I'm always blown away by the amount of volume that you can pump through a 2 OR facility and the acuity that you can bring into that size of a facility. So thank you for all your efforts. And I know you've taken a keen interest in labor management. You and Brittany have partnered on that. And I appreciate all your work on it. But can you talk to us and the audience about how important labor management is and the impact that it can have on a center?
Absolutely. Thank you so much for having me speak on this topic. It really is one of the main costs that we manage as an administrator at a facility. Managing labor does go along with our prior discussion on safety and quality. You can't do it without keeping that in mind. It's not just a dollar amount, but there's so much more to it. So I often start with just looking at our needs as far as our hiring needs. A lot of times a department will let you know when they have a need, And sometimes you really need to assess that department and find out, do you need a full-time employee? Maybe you don't need a full-time employee. Maybe you need a PRN. Maybe you don't need to hire an employee at all because maybe there's someone with a little bit too much downtime that can actually help complete the tasks that need to be done in that department. So I really think, first is just making sure you have everybody in the right spot. Another thing is making sure that you retain your employees. Culture is so important. At our facility, and I believe we do this all across the board at Legion facilities, we make sure that we celebrate all the different holidays and recognize each one of our staff members and, really create a great culture, a place where we don't have that turnover, and that all of our hard work of training our employees pays off, and we keep those employees so we can, not have so much turnover and have to look to replace them. And then inefficiencies, that's a big one. We need to make sure that we improve our inefficiencies. It starts with block utilization, making sure your surgeons are utilizing their block time to the fullest. You don't want to have a bunch of labor on the clock when you don't have any cases going on or big gaps in between. Making sure that those surgeons are getting started on time. That's another metric that we measure, the on-time starts. So, get them started, get them utilizing the block time. Making sure that your rooms are easy to get set up. Do we have all the supplies picked? Do we have a good plan on how we pick our supplies so that we can get those cases started as soon as possible? Our turnover, I always say to the team, all hands on deck. That's everybody that is available, down to our x-ray tech. She's excellent. They all jump right in, every single person. Anesthesia helps out. We turn over that room as quick as possible, get the next case started. And then also recovery. So our recovery time, and I always remind them, it's not different cases are going to recover in different times, but it's not about rushing anyone out the door. Again, we make sure that our patients are ready for a safe discharge, but we measure that. We want to make sure we get our patients motivated, up and moving, and give them a safe discharge in an appropriate time.
Something you mentioned really struck a chord for me. You talked about culture, and you also talked about room turnover. And one of the things I like to look at when it comes to culture is who all is involved in room turnover. That kind of defines the culture of a facility when it comes to, does everyone have that same level of commitment and, I won't say the word humility, but just an all-in mentality to where it says, hey, it's time to turn over a room. It's not the notion of, well, that's not my responsibility. I have to do X, Y, or Z, but really everyone understanding the importance of an efficient operation, getting the patients in and out effectively, and that really it is an all-hands-on-deck approach. So you mentioning that just, I think, got to the core of one of your elements that you talked about with culture. And I think that's something that all of our facilities can really look to imitate as well. So I just want to give you some props on that point.
Thank you very much. Yeah, often, we talk about it a lot at our staff meetings. We do monthly staff meetings. And again, just like recognize your employees, sharing the information with them during those meetings, like how we're doing in turnover time. We've decreased our turnover time pretty well. And, they get excited about that because that shows a measurement of their efforts.
All right. Well, that's really good feedback. I think the other leaders that are listening or watching this podcast can hopefully get some reassurance that they're doing things the right way, because, hearing sort of a best practice coming from your organization, or if there's areas for improvement. Obviously, there's, no fault there. We just want to continue to improve on how we engage with our staff members, how we flex up and down with volume, how we plan ahead, understanding if we're going to have some physicians out, we can adjust our schedules accordingly. And then I think when you're able to have a very transparent schedule with the team members, everyone understands why, this week they may have 40 hours and next week they may have 35, kind of contingent upon volume, et cetera, et cetera. So that's really good feedback, Virginia. Thank you. All right. Last but not least, Mr. Mark, how are you today?
I'm well, Daniel. How are you?
Good. So you've been with the organization for some time now, I think going on 6 years now, between 5-6 years, and have had an evolving role with us relative to our procurement and vendor relations and sort of everything that comes along with that. But that is a key element of our organization. When we look at what we provide to our patients, being MSK focused primarily, that comes with a lot of cost, right? We call it COGS, cost of goods sold within the organization. Implants, disposables, equipment. What is your approach to all of those items? And, And why have we been effective in that at Legion? And frankly, what are some areas that you think we can improve on as well?
Thanks, Daniel. I appreciate it. Well, these three very impressive professionals that just spoke prior to me, they are my customers. They are our customers.
Yeah.
We stay focused on patient care and making certain that everyone that has a lead role or a role at all in patient care, that's our focus, making certain that they have what they need when they need it, and that all of their needs are being met from a cost management perspective. The other department that I and my team service is accounting and finance, and we never can get very far without them and without their support. And we like to make sure that they're happy people and that we're not causing them any grief. So really, a lot of our focus lately has been on end of month accounting responsibilities, making sure that we reduce the amount of out of period adjustments, that we are receiving products in the same month that we're ordering the products, and that we're completing all of our bill only POs, which is for our implants, and completing those in a timely manner. And that keeps smiles on everybody's face at the end of the month. And that is our focus lately, is really to improve our accounting and financial outcomes. We obviously also spend a lot of time, and this is a situation where we love our vendors, but we also recognize that our vendors sometimes can be our greatest impediment to success. So we spend a lot of time on invoice reconciliation and discrepancy resolution, where when we do our three-way matching, where our POs and our invoices don't match. And we spend a lot of time with our teams at the sites, supporting them and making certain that we get those reconciliations done in a timely manner. And then from a logistics standpoint at the facilities, we want to make certain that the team of materials managers and coordinators, that their jobs are as easy as possible, working with the clinicians to support them with improving the par level maintenance and the labeling of where the product is stocked, and also want to improve our forecasting and the management of our requisitions, because without a requisition, you can't place a purchase order to get the product in a timely manner. You also don't want to have too much product. So it's really important that our forecasting is accurate and timely. So that's something that we're very focused on. The other thing is having the right item masters in our system. We're constantly adding item masters to our system. We're always driving product standardization as a system. So that requires a lot of maintenance of our item masters and our charge masters. So there's full-time dedicated employees that focus on nothing but ensuring that our data is correct, and that our categorization and our GL coding is accurate as well. We work very closely with our clinical leaders. We have a value analysis committee that we've put together that we're in constant communication with to find ways to improve the value of what we're delivering from a cost management perspective. And that's a good segue, Daniel. And I can just keep talking. So if you have any questions.
Yes, we know, Mark. Yes, you're doing good. You're doing good. No, keep going. Obviously, your world is critical to our success, and so I don't want to shortchange you, but I know there's still some other areas within supply chain that are critical for us, related to things, being analytical, understanding how we're operating, and then also you mentioned before how important it is the relationships that we have with our vendors, and how that relationship can get us out of a bind at times as well, right? So maybe you can talk to both of those points.
No, absolutely, and that's a great segue, Daniel. We work very, very closely, and we have dedicated professionals with a lot of tenure focused on vendor relationships, contract management, and cost management. And that is the main focus of my job and my team's job, is to manage those relationships. And we need a lot of help. I pull you in a lot. I pull in other senior leaders to help with the vendor relations. We can't do it without all kinds of support at the leadership level with business development as well. But yeah, the focus every single day I wake up, and it's how do I meet my budgetary requirements for 2024 and beyond. And so we're really, really focused on physician preference items and implants. That's really where we spend most of our money in surgery. And so we're always focused on building better relationships with those vendors and making certain that they share our common goals of having a cost-effective solution for our physicians, staff, and our patients. We also take a look at our med surgical or med surg supplies as well. Although we don't purchase as many of them, they're still very critical that we have competitive pricing on our med surg supplies as well. We use a GPO, a group purchasing organization, to help us in managing those costs. But sometimes we find that you have to manage your GPO contracts and contract pricing as much as you do your physician preference items, because they fall off contract, and you have to make sure that you have dedicated folks that are just focusing on those contracts as well. And then we focus on facilities and services outside of the operating room. And a big focus of ours this year, especially with all of our growth and expansion, is all of our capital expenditures. And we have a lot of focus on CapEx spend, managing our budgets, our capital equipment request process. And so that's a huge focus for us in this year and beyond.
Very good. Well, it sounds like you and your team have your hands full for sure, and I really respect and appreciate the collaboration that you're having with the operators as well in the field, with training and giving them access to systems, and as you mentioned before, getting that preference card cleaned up, which will be obviously a big group effort. So thank you, Mark, for your efforts, and really all the team for what you guys are doing for the organization. I kind of like to dumb down the ASC operations in a vertical fashion. The foundation being clinical outcomes, right? We know without that foundation, we really have nothing to build upon. So that one is, I don't want to say it's a given, but it needs to be a given that we have quality outcomes that Lori talked about and that we deliver every single day. But once you start at the foundation, you then move up, kind of to the top. And what are the key drivers, right? We need volume coming from our doctors, good volume, and that's where physician relations comes in to ensure that our doctors are happy, satisfied, they have what they need to be successful. Volume leads to revenue, right? Revenue is the money that comes in from the payers and from the patients, et cetera. And then we've got items that are critically important that we manage the right way, right? So we've got our volume and revenue that are driving our income, but then we want to try to maximize that income as much as possible, right? And we do that by proper labor management, not having too many people, not having too few people where we can't be effective and we have risk patient safety, but towing that line of having the proper level of staffing commensurate with the volume that we have, right? And then ultimately having our cost of goods sold, which is our med supplies, implants, and medications, that also needs to be best in class, right? We want to make sure that we are getting the best pricing from our vendors, that we're leveraging all of our facilities across the board to get the best price, leveraging our GPO, and then the expertise of Mark's team to help deliver on that execution plan. So foundation, clinical, physician relations, volume, revenue. Then we've got our labor management, med supplies, and then everything else sort of falls together for a successful center, with those being the key drivers. And I really feel confident that within our organization of Legion that we've got the right people in the right seats to lead those key drivers. And 2024 is a critical year for us to demonstrate that we have the right systems and people in place to execute on a plan that we feel very strong about. So just to wrap up, again, I want to thank our leaders for joining us, Brittany for being in studio, and for the rest of the team being remote. And thank everyone for paying attention to this podcast that we're having related to successful ASCs. And again, thank you guys for your time. I know you're all busy. And until next time, have a great rest of your day, and we'll wrap it up.
Thank you for listening to Beyond Bones and Muscles, a Legion Health podcast. We want to hear from you. Subscribe and leave us a rating. Your feedback helps improve our show. For more information about Legent Health, go to legenthealthservices.com.